Hi, Jen. How are you?
I'm good.
I wanted to let you know that I'm a psychiatric nurse practitioner. And today, my goal for you is that we sort of assess what's going on. We come up with a working plan and we try to make you feel better. Okay? What we talk about in this room stays in this room. Okay? Only if there's an issue with your safety would I have to go out of this, with anything that's said, would I have to tell anybody. But if it's just something that we just talk about how you're feeling emotionally, all that stays here. It's confidential. Okay. And I wanted to know what brings you in here today.
Well, I just had a baby like 2 months ago, and I should be really happy, but I'm just really feeling sad. I'm not feeling like myself. Like usually I'm a happy-go-lucky kind of person, and I was so excited for this baby, and I just feel sad, and I sometimes rage, and I don't know.
So, how old's the baby?
Baby's 2 months.
And how long have you been feeling like this?
I don't know. Since I delivered, I think breastfeeding was the hardest part, and I felt like so inadequate, and I couldn't feed my baby, and my baby was crying, and I didn't know why the baby was crying, and so. But then breastfeeding got better, and the routine was getting better, and going stretches, but I'm still feeling not well.
Is this your first baby?
It is.
Okay, good. And so now are you breastfeeding?
Yes, I'm breastfeeding.
I'm glad it's going better. It can be so hard in the beginning, and it can really make you feel so inadequate. And, the fact that you've got that going is a really good thing. And I'm sorry that you're feeling poorly. Is there anything that can you describe how you feel, or anything that makes you feel that particular way? Like, give me yesterday. How was your day yesterday?
Well, I think it was going well, and then the baby woke up, we did our normal feeding, and then I just I put the baby down for a nap, and then I just cried. I just was crying. And then, and sometimes in the morning before my husband goes to work, he's trying to help me, and he's so annoying, and I'm like, just get out of my way. I'm just getting mad, and that's not how I am. I'm not like that. And he's trying, but I think that this could hurt our relationship too if I keep.
Is he back at work?
Yes.
And does he work out of the house?
Yes, he's been working out of the house.
So is there anybody else that you have that helps you throughout the days when he's not around? Like, are your parents family members?
Well, yeah, my parents live down the road, and my mom's been coming and helping, and it's been really helpful. She works part-time, and she's vaccinated. Thank God she's vaccinated.
But I'm so glad she's vaccinated. That's one thing you don't have to think about, Well, okay. How about any support groups or any friends that you've made or that have kids yet?
Yeah, and I have one friend who has a kid, but I'm kind of embarrassed to talk about how I'm feeling, because I don't want. She seems so happy and everything's so well, and something's wrong with me that I can't get happy.
Well, I want you to know that sometimes when you feel poorly like this after you've had a baby, or you feel sad or irritable or anxious, that sometimes we feel guilty. And, it's just a natural feeling to feel guilty, but really it's nothing you've done, and with support and with some help, you don't have to feel this way anymore. Now, do you have a history of anxiety or depression, or any medical psychiatric kind of history?
I don't have any history of anxiety or depression, but I have had seizures, and I'm on Lamictal.
Okay.
I haven't had seizures in years and years and years,
Good.
But I have.
And who monitors you for your Lamictal? Who gives that to you? Was it your neurologist?
Yes, I have a neurologist who I see once a year.
And have you ever been in therapy?
No, I haven't been in therapy.
And have you ever had a period, never in your life, where you felt anxious or depressed?
Not.
Or anything? You're not yourself?
Not like this. In college, with that transition was really hard, but I didn't feel like I was, I don't know. Nothing like this, how I feel right now.
So tell me, Jen, how is your sleep? Well, how's the baby sleeping? You're breastfeeding. Before we answer that, do you ever supplement with bottles? Do you ever let your husband give the baby a bottle?
I haven't.
Have you thought about that?
I've thought about it.
So maybe he can take a stretch of time so you can get some time to yourself.
Yeah, I mean, I don't like I just never have like it's been so hard. I just like do what I know I can do, and like I was like, oh, then I have to bring out the pump, and I don't know how to use the pump, and it's just I need to get more help. But it's just been really hard. I just don't want. I just want to just sleep.
How is the baby sleeping in the night? How often does the baby wake up?
The baby does pretty good. Like wakes up, like goes a stretch of like 3 or 4 hours. That's the longest.
Okay.
Right now, we're really lucky when that happens. But I'm doing all of the feedings, so I try to be really quiet because my husband's working.
So are you able to get back to sleep after the baby's done with her feed?
No. I mean, the baby's doing good, but I'm having, like, I'll feed the baby and then I'll, like, fold some laundry. And I know I should go back to sleep, but when I lie down, I'm just like, I can't, like, keep thinking about, like, the next thing to do and the baby and, like, did the baby do okay? And
so you keep do you think of thoughts that keep going around in your head? Is this something that, like, is that something that occurs for you when you can't get back to sleep?
Yes. I feel like I just can't settle. So then I watch the show or look at my phone, look on Facebook. And I know I'm not supposed to do those, but I'm like, what am I supposed to do? I'm like just sitting there like
I know,
with my eyes
it's so
open.
hard. Well, so how many hours of sleep on average would you say, like the range, would you say you're getting?
I mean, I do get some chunks of sleep, maybe like 2.5 hours or so.
That's it.
And like in a row, but I do get some sleep. Like I'll go 2.5 hours, feed the baby, go 2.5 hours.
That's where I sometimes supplementing with a bottle, and it could be with breast milk that you pump, and then you can get like a 4-hour stretch. If the baby, in the early evening, at 9 o'clock, you could try to, if you could, get to sleep and sleep till like 1 or 2 and let your husband do the 11 o'clock feeding. It's just a suggestion to help with you so you can get more sleep. What about nutrition? How are you eating?
I mean, I eat okay, I think.
If I were to ask you, are you able to do self-care, which means just taking care of your needs? How would you answer that?
I think I'm able to self-care. Like
Okay,
I'm
good.
like, because never when my mom's going to come over, I have to look presentable for her. But yeah, I mean, I want to get up and get dressed.
Do you ever think of any suicide thoughts?
Oh, no, I wouldn't.
Have you ever thought, has there ever been a time in your life where you've had suicide ideation or thinking that you want to just...
Oh, no, never.
Has there ever been anybody in your family that has had that?
No, not that I know.
And have you ever in your life felt manic, like, or really, really, really awake at night? You want to clean the house day after day. You don't only need an hour, 2 or 3 of sleep, day after day after day.
No, I've never had that.
And what about the opposite, where you feel really depressed, really sad, hard to get out of bed day after day?
No,
Is there any family history that you're aware of bipolar disorder?
Not that I know of.
Jen, what about any substance abuse? Any of that?
No.
Okay. And
like the alcohol or drugs?
Yeah.
No, I've
okay.
never.
All right. And what about, have you ever had any head trauma? Did you ever hurt your head in anything, concussion or any of that?
Oh, no, I've never done that.
Well, any psychiatric history that that you haven't mentioned in your family history?
Nothing we know. I think my sister might have had some depression, but like
after her baby was born, or not with childbirth?
Not with childbirth. Just like I don't know. She was going through something.
Does she take medication?
No, not that I know of. She was just kind of. I think she was a breakup or something. I don't know.
Okay. Well, I want to applaud the fact that you're here today. I think that when you recognize that there's something not right, that's the first step. And now you're in front of the curtain, I like to say. So the fact that you've decided that something should change is a good thing. And like I will repeat and repeat, with support and with help, you don't have to feel this way anymore, and we will help you. Now, because you just had a baby, the hormones of pregnancy can be responsible for something called postpartum depression or anxiety. And the treatment strategies for that diagnosis, which we can say you have, because you are experiencing this, it's been a month or 2, is therapy and sometimes medication. Now, some people feel, I don't have time for a therapist. I don't want to see a therapist. I just want a pill. And some people feel, I don't want to take anything. I'm breastfeeding. I'm afraid or whatever. And I don't want to take medication. So what do you do? Well, there is no one fits all answer. Okay. The deal is that sometimes both work nicely together, both therapy and medication. All right. Sometimes you can start with just therapy and then add medication after therapy. But you sound like you're really struggling. So I might suggest for you today, if you're open for it, is to start on a medication. And how do you feel about that?
Well, what about the breastfeeding? I know it's probably safe, but is it really safe?
So we could start you on a medication called sertraline or Zoloft. You might have heard of it. And we start at a low dose to see how you will respond to it, because there's always risk factors when you take any medication. And with breastfeeding, there's a very negligible amount seen in the breast milk. There is some that goes through to the breast milk, but it's very small. And if anything, studies have shown that a happy mom versus an unhappy mom is that benefit far outweighs the risk of any medication issues or side effects with the baby. So yes, it is safe with breastfeeding. In fact, it's recommended if a mom is struggling with postpartum anxiety or depression to sort of get you to feel better. Because a sad mother isn't really being good for a baby because she's not happy and you want to be happy. So we really recommend treating it. We can go as slowly as you want. So what about therapy? Is that something that you have an interest in?
Yes, I definitely want to do that.
All right. Well, we're gonna try and find a therapist through an organization that we have in the state called MCPAP. I'm also going to give you a couple of online resources because it's hard to find a therapist these days in the era of COVID, but we can definitely find one. And a lot of these therapists are doing these sessions virtually because of the threat of COVID. Okay. How's your marriage doing? Overall, the two of you? Because that's another consideration. If you're struggling in your marriage, we can also consider couples therapy down the road.
I mean, I don't know, I feel like I'm yelling at him a lot, and I know sometimes he just avoids me, but he can't because we have a baby, so he has to help, and, but I'm the only one that's breastfeeding. I don't know, maybe we need it. I just want to feel happy. I feel like if I was happy or happier, I should be happy. I just had a baby, and then things would get better.
People don't talk about how hard it is. It's like, yes, you have this baby and it's a wonderful thing, but it's hard on a woman. It's hard not to sleep every day, every single night. It's hard. And it's just not talked about for whatever reason. So I get it. And I'm sorry you're feeling this way, but we're going to try and help you. So I want to talk to you about starting Zoloft. How do you feel about starting that?
I think I'm fine with it.
We're good. Okay, good. Okay, I'm okay with that. I tend not to push medication right away, but in your case, I do feel like it would be beneficial for you. So today I'm going to talk to you in a moment about Zoloft, but I'm also going to let you know that I'm going to email you some names with some therapist referrals, and I'm going to give you some online resources. So remember, we're going to start you with this medication called Zoloft, which is under this category called SSRIs. Basically, it's just your first line of antidepressants that people will take when they're feeling like this. Okay. One of the major side effects that can happen that's really, really unusual is that you feel worse, even suicidal. And if ever you were to feel that way, which is very unlikely, you would stop taking the medicine and go to the nearest emergency room to be evaluated and to be safe. That's not likely to happen, but it's important to know. The first few days after starting it, you might feel a little queasy. You might feel foggy in your head, and typically that goes away in 3 to 4 days, which is why we start you out at a small dose, 25 milligrams. And then after about 5 days, I'm going to suggest you go to the 50 milligrams. And then I want to see you in 2 to 3 weeks. Does that sound okay?
Yeah, that sounds good.
Great. And if you need me at all throughout, you can always write me an email through our system, through the Gateway system. I'm always available for that. Or you can always call the office, and the nurses here will help for any questions of anything. Okay? It will take usually 2 to 3 weeks to feel the impact of this medication. And the goal is that you feel better. I also want to suggest to you, Jen, that you consider giving that baby a bit of a bottle Okay, with pumped breast milk formula, whatever you want. So you can get a stretch of sleep in the early part of an evening, or however you and your husband can figure it out, so you feel a little bit better with reserve. Because right now you're running thin on no sleep, and that's really hard. And sleep's like a medication. What do you think of this?
Yeah, I think I can try to do that.
Okay, good. All right. Well, I want you to make an appointment in 2 to 3 weeks to come see me. And I'm really glad you came today. We're going to really try and help you.
Thank you so much.
You're welcome.